Hi, Cora. We're going to talk about your postpartum instructions, and I want to talk to you and your partner, Daryl, because it's good for dads to know what to look for as well. First of all, we're going to be looking at bleeding. You will be experiencing vaginal bleeding. The first couple of days, it will be red, like a heavy period. It's called lochia. When it's those first couple of days, it's called lochia rubia because it's the darkest of the blood. Some people bleed for up to 6 weeks, some people don't. It's just completely dependent on your body. And it's normal to see red blood initially, and then it'll graduate into pink, brown, and then white, and then nothing. Um, if you're soaking more than one pad per hour or passing large clots or experiencing an increase in bleeding, then call me right away. You have my number. I actually gave you a magnet, remember, and I stuck it on your fridge, and then I think you also have it in your phone, but just make sure you have multiple places to be able to get numbers to get a hold of me. For pain and discomfort, you will be experiencing some cramping. It might get worse during breastfeeding. It's just from your uterus involuting back down to a smaller size. Use warm compresses for cramping. You can take over-the-counter pain relief like Tylenol or ibuprofen, and just make sure to follow instructions on your labels for those. You don't have any incisions because you didn't have a C-section, so you're good to go for that. For your emotional health, I really just want to make you aware that it's really common. People experience what they call baby blues. You're doing some humongous hormone shifts and humongous hormone changes in this postpartum time. So if you start to feel a little weepy or not your best, that is okay. Talk to your husband, talk to a friend, talk to me, and we can kind of get it all sorted out for you. The other thing that we really want to encourage is that you get tons of rest. So you kind of like we have this rule, it's called like 5-5-5. So 5 days in the bed, 5 days around the bed, 5 days around your house. And you really want to adhere to that. Just give your body enough chance to heal the wound inside, bond with your baby, enjoy your time. Get lots and lots of good nutrition, lots of good food, calorie dense meals, lots of hydration for right now. For the baby, we're looking for that baby to eat every 2 to 3 hours. I know that people get excited when their babies sleep through the night, but we don't want that to happen quite yet. So if the baby is sleeping through that 2 to 3 hour period, I want you to go wake that baby up and feed that baby. Okay. You'll notice hunger cues like rooting or sucking. Sometimes they get frustrated. Really, at this point, you're kind of a pacifier, and that's okay as you're establishing your breastfeeding journey. So we also want to make sure that the baby has about 6 wet diapers a day and about 3 bowel movements per day by the end of the first week. Those first couple days can be a little funny as the baby's insides are learning how to work and do their job, so we give them a little grace there. But by the end of the week, we want to see 6 wets and 3 poopies. And if the baby isn't pooping or peeing and you're worried about it, give me a call. As far as the umbilical cord goes, make sure to just keep it really dry. Baby doesn't need a nap probably till the umbilical cord falls off. So just keep it really dry and exposed to air will help to dry it out. It should fall off within 1 to 3 weeks. If there's any concern for infection, give me a call. If there's any redness or a bad smell or anything like that around the cord, let me know. Warning signs for a baby. Difficulty breathing, if they get really, really grunty, if they have a temperature above 100.4 or below 97.7, if they're not really feeding well, if they seem very lethargic and they don't really want to do anything, if their skin gets kind of yellow and their eyes get yellow, those are all warning signs that baby might be in distress and you need to give me a call and we'll get you sorted out, okay? My contact information, remember we have the magnet that we stuck on the fridge. You should have my number in your phone, and I think your husband does too. So anybody can call me, text me with any questions, any concerns. Do not hesitate. That is what I'm here for. If there is a emergency, call 911. Don't call me. I want you to just really enjoy this time, enjoy that baby, take the rest you deserve. and you did a really wonderful job. Reach out to me if you have any questions, and I have paper handouts about all the things we discussed, and I'll just leave it here in your file. Okay? All right. Talk to you soon.